Hello, everyone. Welcome to another exciting episode of the Youth Cafe podcast. Today, our topic for today is youth and mental health. And with the increasing cases of mental health issues among young people, this topic warrants discussion and it should be addressed openly. That is why I'm joined by a group of young people here who are well experienced and very creative. So, on my far left is Esther Maende, who is an advocacy officer. Then next to me here is Moses Wamari, who is a programs and research manager. And then we have Caroline, who is a student leader at the University of Nairobi. Karibuni sana. Our first guiding questions for today's discussion is, how do you define mental health and what are some of the misconceptions and stigmas surrounding it? And we start with you, Esther. Yes.
Okay. Thank you, Faith. So, in defining mental health, I'll start with the definition of health because mental health is not detached from the whole definition of health. So, WHO defines health as the state of physical, mental, and social well-being of an individual, and not just merely the absence of a disease. So we find that mental health is intertwined in the whole definition of health. So you cannot say someone is healthy when they are not mentally healthy also. So ideally, mental health will define it also as the state of mental well-being. And most of the time when we say mental health, we imagine, the mental health illnesses and challenges. But that's not what mental health also means. That's not like the whole definition of mental health. Mental well-being encompasses the ability of a person to, be able to contribute to the society, be able to face challenges and, come out of them, and be able to, do whatever they need to do and accomplish and have that sense of satisfaction. So it doesn't just mean, when you say mental health, people think that it talks about having mental health issues. No, it also talks about being healthy mentally, being able to carry out your activities and contribute to the society. So the stigma that surrounds mental health is just that, like one example I've already mentioned. When you say mental health, someone thinks of someone has mental health issues, which is not usually the case. Mental health well-being encompasses all those aspects. And when you term mental health, people think of someone who is out there and without clothes and going around the street, or where we say that people are mad. Mm-hmm. And that's one of the biggest stigma that we have. And then some of the stigmas is that when someone is happy, they don't have mental health issues. When people are wealthy, maybe they cannot experience mental health issues. I think as we go ahead, we'll get into the deeper definition of what mental health well-being is, and demystify some of these stigmas that people have brought around.
Yeah. Okay, thank you so much, Esther, for that concise description. Maybe if Carol or Moses have, if any one of you has anything to add, maybe you can add on the same.
Yeah, thank you very much, Faith. I think Esther has elaborated the mental health definition very well. Maybe I can just add that mental health encompasses being in the right state of your mind so that you can be able to do your daily activities well without any form of stress or without any form of limiting factors. Mm-hmm. So I think that is also what can be added as to the definition of mental health.
Okay, thank you, Moses. Carol, do you have something maybe?
Thank you, Faith. She has said that most of the people out there term those who walk naked or maybe talk to themselves as mad. Mm-hmm. I think mental health, because we have stated it's the state of being, the mental well-being, it's intact. Yeah. I think some mental health issues, they are the ones that lead to mental illness. Yeah. So there is a difference between mental health and mental illness. Mm-hmm. Yeah.
Wow, that's nice. So on to the next guiding question. what do you think are the main contributing factors to the increasing cases of mental health issues among young people, from where you guys sit?
Mental health issues or problems or illnesses are brought about by a myriad of challenges. Ideally, some of them can be even genetic. He has mentioned social issues. Like currently in Kenya, we have a high cost of living, very high cost of living. And, you are expected as a person to be able to provide for your family. As a young person, we have black tax and all those things. So all those stresses of finding a job, not finding a job leads to anxiety, and then eventually leads to depression, and eventually it progresses to the next level. So that social issue is one of the social and economic issue is one of the causes, one of the contributing factors to mental health issues among young people currently. And we may find also that some of the mental health issues stem from our environment, from how we were raised up. You will find that how the environment you are brought in, how you are brought up, it brings in some aspects of mental health issues, which as you grow up, it manifests in different ways. And some of these mental challenges we are talking about includes maybe social anxiety, includes bipolar disorder, includes stress. Actually, stress is the one that progresses to become depression. You start with stress, you go to anxiety, and it progresses to depression. So there are a myriad of factors that cause mental health issues, and some are contributing factors, like the economic challenges you have mentioned are contributing factors. Like that is one of the major things I can speak of. There is another time I was speaking about. There's another young guy in Nyali who, being weighed down by the social issues, like the current economic times, jumped over a bridge and committed suicide because of the state they were in. The economy is high and they could not talk to anyone, and people are like, even if you talk to us, we can't help you. So those are some of the issues that are causing this. And then other things are contributing factors, maybe academics, education, to expect you to do better and you pass all your exams with flying colors. And those are some of the things that contribute.
Okay. Thank you so much, Esther, for that. Before we hear from Carol, I also have a few to add. One, a major contributing factor to the mental health issues is the relationships that young people have. You find people get into relationships with too much expectations, and they start manifesting their insecurities and everything on their partner. And now the partner starts getting weighed down by these things. Or even in other cases, you find that you want someone, but the person doesn't want you. So what do? You start getting stressed up instead of moving on to the next person who wants you actually. So that is another thing. And my advice on that, if somebody really doesn't want you and you want them, just move on to the next person. Okay, the other factor is family issues. Like currently in Kenya, we're having a very high rate of divorce. And say in campus, like somebody is in campus and their parents are divorcing. This is a whole new situation, right? And they have not adapted. They are used to a family setup, to the love, to the care, attention. They resort to going to find happiness in drugs, other things. And now when they don't have money for the drugs and other things, they don't have peace of mind. So it's an unsustainable way of looking for happiness. So that is also another contributing factor. And last and not the least, online violence. For example, if somebody posts a picture and it's not the socially accepted type of body that they are posting there. Maybe they are just having fun with their bikini on in the beach, but you find all sorts of comments hapo, like you get called a hippo, everything. And then your self-esteem goes down and down, and you find this person will not even be wearing the clothes that they want, they would love to be in. So those are some of the contributing factors I have seen. Even people I know get affected with by. Sorry. So Caro, if you have
Yeah, so actually I've said a point on relationships, but I also think being lonely, it's also something that contributes to mental health, because you don't have someone to open to up. So you're like, I have something that is killing me inside, but who do I go to and tell so that I can feel relieved at the moment? So I think despite having those relationship issues, we need to have some close connection. It needs a connection actually for you to be loved and for you to be around people. It's not all about I need this person to be in my life. So I think loneliness can also be part of the contributing factors. And actually you have said about divorce. There are so many kids right now who are going through a lot, and they will grow up having those traumas. Actually, the most triggering thing, it's about childhood traumas. So many of the youths carry the traumas they had in childhood. They have never recovered, and they don't want to talk about them. And if they talk about them, they see like, I'm exposing my whole life. And I can't even relate with some people because I say this, I say that. So I think childhood traumas, we need to find a solution to that. Yeah.
So just to add, Faith mentioned about drug and substance abuse. So young people can get into drug and substance abuse because of some of the issues we have already mentioned. And some of them may also get into it because of mental health issues. So it can be a contributing factor, and it can also be a kind of an end result, or an end result. And then also we have mentioned most of the things, and we have not mentioned that some of these mental health issues can stem from traumatic events, like the wars, the political unrest that happen, from natural disasters and all those, like the post-traumatic stress disorder. I kind of struggled with that, after the 2007 election, when you hear people shouting outside and people running, you think of what happened, and it brings out all sorts of issues. People don't understand that. So the wars and some of these traumatic things that happen also bring about mental health issues among young people. So when the leaders think about when they come to election, they should think about that critically, because cause those violence.
Yeah, and maybe just to add that mental health can also be caused by pressure, the expectations, especially from the society, whereby young people want to try to live according to what the society expects them to. So you find that you push yourself to the extreme wall, whereby now you cannot relieve yourself, so you end up getting depressed just in a bid to achieve what society expects of you. Another reason may be because of responsibilities, especially increased responsibility in the face of the hard economic times. Yeah, you find that young people just maybe transitioning to the family life, and which they are not used to. You find that you are used to being provided for by your parents or guardians, and so you are transitioning to the next level of your, next section or level of your life. So you find that before you adapt fully, it will give you a lot of stress, which can maybe lead to mental health issues. Thank you.
Yeah, on that, I have a question, maybe I can get an answer from you. Do you think change of like a job's environment or school can affect you mentally? Because for schools, yeah, some students, yeah, but for job, some do it for like, I need an environment that is quite conducive for me.
Yes.
But yes, for school it's understandable. But for job, does it create a mental health issue? Maybe.
Yeah, maybe to try and respond to you, I think transitioning from one job to the other can have mental health implications. Say if you are in initially in a very friendly environment, you are just yourself, but then you are now in a whole new environment where you don't have people to talk to. There is pressure left, right, and center. You are supposed to meet deadlines, and you don't have friends. I think it can have some mental health implications. And then it can have also positive mental health implications. Say you have changed from a toxic working environment, now you are in a very conducive working environment. So it goes both ways.
Yeah, that calls for actually now we need to start critically speaking about workplace mental health. It is very critical because these are the same people who go home and raise these children. And you have said one of the leading causes of mental health is childhood trauma. So you come from work, you bring this home. So we need to have, workplaces need to have strategies on how to ensure that the workers or the staff are well mentally, and even have sessions on how, self-care sessions for the workers, train the staff on mental well-being. I know of an organization, a feminist organization that they just take off some time for self-care. Like this time they took a whole week, all the workers took a whole week self-care session to just go and unwind. This was not a holiday. It was not like, the leave days. No, they just decided we're going to have a self-care week, and they took off and, they went home and had their self-care sessions. I know organizations that have, self-care packages. They give you self-care packages to their staff. Hey, I have worked in one of the organization, and you give the self-care things, So I think it is something that the organizations need to focus, because if the staff are mentally well, they put into their work well, and the productivity of the company will improve. Other than when the staff is stressed, their productivity obviously is reduced.
Yeah, I actually agree with you totally, and even maybe to the bosses watching us, like time taken off for self-care is not time lost, because you are investing so that you can have better productivity from the staff. So don't see it as a week wasted. It's not wasted. You're boosting the productivity. And I feel like we've gotten into our next guiding questions. Guiding question, which is some of the effective strategies that can be implemented to support young people, so that we can reduce the number of cases of mental health issues that are there. And Esther has brought one up. So if any of you has additional strategies that can be employed to support young people.
I can speak about, apart from mental health education, I can also speak about maybe young people being connected with some of the, counselors, maybe counseling sessions in schools, in the universities, or any training institutions, whereby these young people can get information on mental health and also counseling on mental health. Yeah.
Okay. I think I can add more on that. First of all, we are speaking about creating awareness. Many people don't know about mental health issues or illnesses. Traditionally, when someone was what they called as mad, they would call traditional healers, which still happens, or take you to church and they pray for you. They say you are bewitched or something. People still have that mentality. There is no a good understanding of what mental health well-being is, what mental health illnesses are. I was talking to a friend recently, and trying to describe what bipolar disorder is. It has a high moods of the moods of high and very low. So you may be talking to a person right now, they're very happy. The next minute they are very low, and you are like, umekuwa poa sahi, what happened? You start judging them and maybe saying that wanajifanya, or they're just making something up. But that's a mental health illness. People don't have any understanding. Yeah, they don't have any understanding. So sometimes we judge the public, but then we haven't created enough awareness for people to understand what mental health disorders are, the strategies that they can employ to help those going through the same situation. Because people will understand or perceive it as a mental health disorder when it has, gone far to depression. And as I said earlier, it doesn't start from this depression; it starts from stress. Because proceeds to anxiety and all that. So the people will now see when you are already in the last stage, which is depression. So I think we need to have a robust awareness creation. Awareness creation to the public. We need to integrate it in our education system. The way we have HIV as part of the education system, we need to integrate mental health as part of our curriculum, so that as we grow up, it's a health issue. I already mentioned that. So people need to have an understanding of that. And with the increased numbers, it calls for that urgency. So I would like it to I would propose that we have mental health as part of our curriculum. It is one of the strategies to raise awareness, and more awareness campaigns should come up. I would like to hear the radio station speaking about this. I would like to hear churches speaking about mental health and strategies on how people can help each other. I know people who have known someone has mental health and have no idea on how they are going to help that person. So awareness creation is very important. The way we did for the sexual reproductive health and rights. Right now, you speak to someone, they know where they can get their family planning, they know where they can get information on reproductive health. So that needs to happen for mental health. And then I know we have policies. We have good policies and programs from the Ministry of Health on how to scale down information on mental health. I know the government recently, signed the 4 health bills. One of them being the, primary health care, and I think the new trained healthcare promoters are trained to identify mental health illnesses in the community. So I hope we have great reporting mechanisms so that we can have data from the local communities on how the state of the mental health in the community, and I hope they have good referral mechanisms so that the cases can be able to be picked up, and the people going through mental health issues receive the required intervention. So I'm imagining if all healthcare promoters nationally were able to disseminate information on mental health to the community, the local community, this will have a really good ripple effect to creating awareness and ensuring that interventions are taken into place. Another thing I would like to answer, so I was speaking too much, is the people who have gone through the mental health challenges. Let them speak. Let them be there, share, be free to share the information. Yeah, let them share the experiences. Yeah. So it's called what? Survivor. You let the survivors be able to speak, share the experience. The young people usually relate.
And how they coped.
Yes, yeah. I listen to you. I'm going through the same experience, but someone coming and talking about that when they don't have experience, it will not be very as effective. So let the survivors, give them a chance to share the experience, a chance and an open and good space for them to share the experiences, so that those who are going through the same can be able to yes, learn from them and also be able to take initiative. And that will also help end the stigma that we are talking about. Yes.
Thank you so much for that. And we allow you to own this space as a health expert. So I also have some few interventions that can be adopted to to reduce the number of mental health issues. And one is we mentioned about the family issues and the divorce cases affecting the young people. So I wouldn't tell the parents if it's not working out to stay together, no. But if you are divorcing, please get a strategy like maybe get a therapist to talk to these young people, and then the therapist will work with this young person and ensure that they are able to adopt to the new life, and everything starts maybe falling in place. Another thing is maybe if you are in a position to help somebody who maybe has mental health issues because they don't have a job, and now they are not able to cater for their basic needs. Stop. Usikue mchoyo. Don't be jealous and say the God manze. You know, I saw that meme that people are telling their friends the God manze. Connect your friends. So give them the opportunities so that life goes up and down, right? So this person that you connected, you might need them, and they will connect you to the other place.
Or even your kids.
And your kids and everything. So connect and support your friends. Another thing is for parents. And I think we had this discussion previously, like after somebody graduates and it's a bachelor's. I don't want to say it's just a bachelor's. It's a bachelor's degree. Now you are like not in their care anymore. You don't have a job, or if you have a job, you are earning not a lot of money that can cater for you and your family. So the parents, after somebody graduates, please don't put the burden to these graduates immediately, like now they are there. The parents, no, please continue supporting. I've seen some parents who support people even as they are working. Like you hear your parent says, no, I will support you to get a master's degree, which is very nice, and it gives this person an opportunity to grow. And now when they get a master's, they're able to get even a better job. They can take care of the family from there. Yeah, thank you.
So to contribute on that, I think it all starts with you about self-help. So if you know you have some sort of anxiety, like I can't talk to a large multitude of people, it starts with you. Start talking to a group of 5, a group of 10, and with time you'll overcome that anxiety before it even goes to depression, that I can't even go out of my room to go and talk to someone, even a single person, even for one day. So I think it's all about self-help. Start with you. And you'll even gain that courage to go. If you have a problem, I might say, I have a problem. Maybe go to Faith or Moses or you. And I will talk and it will be solved.
Yeah.
And then the second one, it's medication.
Yes.
But about medication, I have 2 parts of it. Let's not force those who are going through mental health issues to go see a psychiatrist or a counselor. They might have their own reason why they don't want to go see the counselor or the psychiatrist. So, but if the person is willing, please go get the medication. But if you have another, let's say if you have another solution to that, then we accept, go take the other solution. It's okay for you. But then don't force someone to go take medication.
True.
They might do it on an overdose thing so that they can commit suicide and take, because they feel like you're pressuring me too much and I don't need this.
So just to add on your point, that we need to create the caregivers, the guardians of those people who are suffering from mental health illnesses, how to create a safe space for these people first. They have to create a safe space where they can, be able to express themselves, say what they want, be able to say what they would like, what would like to be done, right? If the mental health issue is advanced, they can select someone, like a guardian for their sake. Let's say in a family, I'll say maybe my big brother is the one who will be making decisions for me, and whatever decision he makes, that I will follow that decision. Don't impose any decisions on the person. This year's theme for mental health was Mental Health Day, which was on 10th August, was mental health as a universal human right. That person has their right. They have their say in whatever needs to be done to them. So that person is a human first, and all the human rights apply on them also. So you cannot go ahead, making decisions for them and you want them. You understand very well that they have this condition, but you have to create a safe space for them to be able to also decide on what they want to do. If they are incapable of making that decision, they have to appoint someone who can make that decision for them. Our families usually say, now this one, you have alcohol problem, we'll take you to rehabilitation. And these people don't want to go to rehabilitation. Maybe they just wanted someone to talk to them, sit down, discuss with them, and let them be part of the healing process. If you don't give them the chance to be part of the healing process, it adds on to their mental health issues. So thank you so much for bringing that issue. Bringing that issue up is very important.
And it's also important to note that when a family member is suffering from mental health, then there's likeliness of that effect affecting the whole family. The close friends, the colleagues at work, and even the, let's say, the relatives. So when one of you is suffering from mental health, it is the responsibility of each and every one of you to come to the help of this particular person, so as to safeguard the rest. Yeah.
But then as you do that, there is something called compassion fatigue. This now cuts across even those who are taking care of other people from other illnesses, right? You have to prioritize self-care also. You understand you're taking care of someone who is not healthy, but you have to understand you have to also take care of yourself. So there's something called compassion fatigue. Just make sure you don't go through compassion fatigue. That's why we are advocating for self-care. Have some time, go in nature, meditate, maybe do something good for yourself. Buy something good for yourself. Eat your favorite food. So prioritize self-care. That is something I'm telling the young people.
It is you first and the others.
When we are a community, I don't dispute that. We live in a community. But then prioritize your self-care, and then now reach out to others and help together as a community. The other thing I wanted to talk about is trauma. We talked about family traumas that bring about mental health issues. So I know we are living in a fast-paced world where the parents are running out of schedule, looking for fees and everything. The economy is high, I understand. But then we are raising children. We are not, maybe a fish lays eggs and leaves the kids to fend for themselves. No, fish doesn't do that actually. But they take care of the kids. So even though we are fast-paced and looking for opportunities and all those, we have to prioritize our children. We have to raise our children, not to let them live. Raise them, create a safe space where the kid, when they have had an issue in school, they can come and freely speak to you and you listen to them and be able to solve the issues that come about. Let parents be there parents and guardians be there for their children. Listen to them, speak to them, and help them grow. In that way, if they have an issue, they can easily be able to share. When the parents or guardians are not there, the kids will not have a space to share. And this piles up, and then we get traumas, which will be taken to the spouses later in life and to the kids, and the cycle continues. So let's stop the cycle of traumas. let's be the one to stop that. And also the cycle of abuses and all that. If there is any abuse in the family, you know, the likelihood of the kids taking it to the next level is very high. So let's stop the cycle of abuses and violence in our family, and then we raise up a generation that is self-aware and that is able to speak out openly, and that brings up as a generation that is free of mental health issues.
Yeah, and to add on that point, it's normally said that the first teacher of a child is the parent. So as a parent, you should be the first person to be teaching your children about mental health education, about good lifestyles, so that these menace can be cut at a younger age.
Yeah. So before Faith comes in, the other thing we have forgotten really is, I know Kenya we have some good policies on health. I know the government has taken initiatives on building hospitals and providing facilities for mental health. We have not yet reached there. We have not integrated it. I know one of the like 40% of the major causes of illnesses in Kenya is attributed to mental health challenges. I would like to go into a hospital, the OPD section, and they assess my mental health well-being, because it contributes to a large percent of the illnesses in the outpatient department of the hospital. So I would, and I want as a young person to be very free to walk into an hospital and then share my experiences with the healthcare workers, and they can be able to help. So I don't know how this can be done, but it needs to be integrated in our system. And then the cost of seeking mental health in Kenya. I have a friend who the brother was diagnosed with depression. You know how much one single session of counseling was? And how much the drugs for 2 weeks was. The drugs themselves, it was 2 weeks. The drugs alone were 30,000. This is 2 weeks. How much do Kenyans earn? And then you haven't put the consultation fee. And this is, you're not taking the drugs for 2 weeks. You're taking them for some good time. Which young person will afford that?
Not enough.
So the cost of seeking mental health in Kenya is still very, very high. I don't know what the government is doing about that, but it needs to do something urgently. As we have seen, the mental health issues in Kenya are rising. And as the cost continues to be high, we'll be losing young people to mental health illnesses, and losing the productivity of a nation. So the government needs to provide comprehensive, youth-friendly mental health services in Kenya, in all health facilities, free of charge. Provide the psychologists. If that is possible, it will be really great. Because when you think about going to a psychologist and that, you just say, maybe your problem was actually financial. So just say, let it be. Yeah. So the government really needs to really look into that. And maybe every sub-county needs to have a mental health facility. Currently, we have very few. Very, very few. And the way you are treated also in those facilities need to improve. Yeah.
Okay.
So just a minute on that, we have said about the government. But last week, the Chief Justice, that is Mother Koome, suggested a bill on, when you commit suicide and it fails, you are given a jail term. But she's suggesting, why don't we talk to those who attempted to commit suicide but was not successful? Yes. Let's not give them a jail term. Let's give them the mental health management and try to talk to them and find out what did they want to. Attempted suicide. Yeah, I think that is a good thing, and I hope it comes into action because it will really help many youths.
Our eyes are on our legislators. If it fails, we will not take it lightly, because that is something they need to look at very keenly. So so that we don't dwell so much on that, we have our next guiding question, which is what steps can schools and educational institutions take to ensure that they are nurturing an environment that prioritizes mental health for students and young people. I know Esther had mentioned about having mental health incorporated in the curriculum, but I feel there are more. Maybe I could even start. For example, there are things teachers do that think they are just joking, but they have a very big impact on the student. Maybe you are in grade 5 and your teacher is telling you, wewe ni kama babako na vile unaangukanga hakuna kitu unaweza shika, you cannot get anything. You see, I saw a TikToker say that the TikTok, I think it's even Diana Marwa. She was very angry at the teacher because the teacher kept saying that she cannot achieve anything. But right now, she has her house, she has some good cars and workers, and she was moving. And I loved that video because I appreciate our teachers, don't get me wrong, but there are some who are too extreme. Like they even judge you by your appearance. They come, they tell you, nywele yako ni kama ya. By the way, there was a teacher who told me, my hair wasn't growing very long. The teacher used to pinch me and tell me, nywele yako ni kama ya these birds. It's too small and it doesn't grow. And you see it, okay, I'm strong, it didn't affect me. But I'm imagining if she told somebody who has a very soft heart, because we are not built the same, that person would even drop out, because they are just a child, right? So that is something that schools and educational institutions should take up. Yeah. Next.
Yeah, maybe I can add on the establishment of counseling centers. Well, we cannot say that they are not there. Of course, nowadays, most institutions, especially learning institutions, they do have counseling centers. But they can mainly, they can improve them to youth-friendly standards. So that when a youth visits those facilities, the kind of treatment there is youth-friendly, so that they don't shun away from visiting such kind of facilities. Yeah.
Actually, the thing I would suggest is, in those schools, yes, there are those facilities, as you are saying, Moses, but the workers who are there. You want to tell me I can go talk to someone like my mom's age to tell her that I had a breakup yesterday with my boyfriend? How? We will be like, mbono kona boyfriend. Yeah. So we need like the age limit to, the schools, give someone who they are close, they can be close to. Someone within the age bracket of a youth also, because we also have doctors who are youth. Let them be in those offices. Stop making someone who is 70 years to stay there, and I wouldn't be comfortable going to talk to that person. Because I'm talking to someone like my mom and my dad, and I'm not comfortable with that. So the age limit in those offices, in those school counseling offices, we need to work on that.
I actually agree. Yeah, exactly. And some schools have those institutions and buildings set up. It's written guidance and counseling. But in real sense, what goes on there is not even guidance. You go, you start talking about your problem, and this person is the first person to judge you in a very bad way, right? Like how you're saying, you go tell them you have a boyfriend, and they ask you, unafanya nini na boyfriend side? But at their age, they also had boyfriends. Right? Excuse me. Yeah, next.
Okay, for me, I'll talk about now the workers in those institutions themselves. If we want to have a holistic approach to mental health, those working in those institutions, the way I said, the staff need to be, given priority. They need to have self-care. The institutions have to ensure that the workers there also, their mental health well-being is prioritized, so that they can trickle down to the students and the learners. I have been in a university where you go and you're talking to the secretary and you're like, what happened to this secretary during the night?
She should heal.
So I think the institutions themselves need to train the staff on mental health and well-being themselves first, and then now they can be able to trickle it down to the student. And as you have mentioned, the guiding counseling offices need to be friendly, accessible, and they have to have staff there. I know counseling centers that the teacher, the teacher of math, the math teacher, the math teacher
is the counselor teacher. And so, they abused you in class. That's why you have that's why you are suffering inside. And now you want to go and pour out to the counselor, and they are the person who they are now the counselor.
So the institutions need to critically look into that. So if you bring up, like from primary, the guiding counseling, the staff are well conversant with this, and they are taking good care of the students as they progress in their life. It is easier for them to share this issue. It is easier for now the whole society to be able to express themselves and heal and intervene at the right time when the intervention is needed.
Right, and I feel those people working in the guidance and counseling offices in schools should sign some sort of agreement, like do not go to take the issues that you are brought for by the students to the other teachers, because you may just be chilling and you are in class, then a teacher who you didn't tell anything comes, and they start, and it's not even funny, because now it creates something very it creates something distrust, and you feel so bad because now ameambia kila mtu, even the students.
So the next time, just prefer to suffer in silence than to seek help.
Actually, I think also the mentorship works well in campuses, because you can have a senior you look up to and you can be comfortable, you can talk all aspects of life with that person. And I think for some, not all students, but some students are comfortable with that. So mentorship, and it should be embraced.
Exactly.
Yeah.
Okay, sorry. So now this is a very interesting topic. In what ways can technology and social media impact the mental health of young people? What impact are we having on mental health? It's a positive impact, because we are advocating for better mental health practices. So that is one positive impact that technology and social media can be used for. On the negative end, though, is that we have online bullying and other things like Twitter. Hey, if you are trolled on X right now, hey, you will even go. Hey.
You find yourself trending, like scoring money.
Yes, you are trending everywhere because of something even quite small. So mine is to thank you guys for your time, for your very innovative solutions and your experiences. And thank you so much. See you next time. That has been the Youth Cafe podcast. See you in the next episode.